Hello, welcome, and thanks for joining us on this edition of News 2. I'm Sandra Goomansingh. The Senate Committee on Education and Workforce met Tuesday to consider a controversial bill to ban corporal punishment in public schools. After hours of testimony, the committee voted to hold it in committee. News 2's Erica Parsons has more.
Senator Judi Buckley wants to ban corporal punishment in public schools.
My mission with this bill is absolutely not to remove discipline, but to remove the use of corporal punishment.
Senators heard testimony from education officials, VI psychologists, and the American Civil Liberties Union, who all echoed support.
The department reiterates its full support of this legislation.
The American Psychological Association opposes the use of corporal punishment in schools.
It should be used as an absolute last resort.
But officials from the Board of Education and the Teachers Federation had concerns.
We do have some concerns about the lack of specificity.
The bill lacks clarity and is open to unlimited interpretation and invites perpetual lawsuits.
Corporal punishment has long been a part of VI culture, and some senators struggled with the conflict of being raised with corporal punishment in schools and understanding now that it's having negative effects on students. Psychologists cited evidence that physical discipline doesn't improve behavior and that it in fact has a negative impact on academic achievement and long-term well-being.
Many children who have been subjected to hitting, paddling, or other harsh disciplinary practices have reported subsequent problems with depression, fear, and anger. One study found that states where corporal punishment is frequently used, schools have performed worse academically.
The Teachers Federation said it opens the doors to challenges of maintaining discipline. The A.C.L.U offered positive behavioral supports as an alternative to corporal punishment, and they're working on legislation to ban it at the federal level.
We have to come to the realization that our community has changed. And it is no longer okay to be doing this just willy-nilly.
Erica Parsons, News 2.
More than 100 countries have banned corporal punishment, as well as a majority of states in the U.S. The Senate committee also heard testimony Tuesday on a bill to establish charter schools in the VI. Well, a foul odor has closed the doors of Frederiksted Health Care Center for the second time in less than 1 week. According to a statement from the center, fire and DPNR officials were called to the scene to investigate the smell and test the air quality. Several people were treated for reactions to the smell. Witnesses say the odor is noticeable from as far as the upper love area. And during a Senate hearing, this statement was read.
The Frederiksted area is once again experiencing an offensive odor experience on Friday, October 4, 2013. This odor is not limited to the legislature, as EPA has already deployed teams to the Frederiksted Health Clinic to investigate the report of the odor in their area. The Chief of Operations, James McNamara, has made contact with EPA, and the team is being deployed to the legislature to attempt to identify the source of this odor. Additionally, the Executive Director is contacting the Waste Management Authority to have them investigate this problem from their end also. We provide updates as we receive them from the agency investigating this matter.
Frederiksted Health Center remained open Tuesday to treat emergency cases only. The full center will reopen Wednesday at their usual time. Well, the fire station in Dorothea has been opening and closing in the past decade, but now it is definitely operational, and it has a new name in honor of a veteran firefighter. News 2's April Knight has the details.
Northside residents might feel a little safer after Monday's formal opening of a fourth fire station on St. Thomas, this one in State Dorothea.
I'm certain that the residents of the Northside community are pleased to see the new state-of-the-art fire station is ready to be a part of this community again.
The fire station, now home to the Echo Company, is named after Emile Barry, who joined the force in 1972 and was the first firefighter of French descent in the department.
We have a beautiful facility here. It's a great honor to have this fire station name on my name.
The newly opened fire station in Dorothea, named after veteran firefighter Emile Barry, is strategically located to shorten the response time to fires in this area.
You have to take in consideration the terrain. You're talking about carrying sometimes up to 3,000 gallons of water in the fire apparatus. And it will be coming up at a slow pace.
Emile Berry is a satellite station. It can assist other fire stations in the event of big structural fires.
In the event that there's a major fire in the downtown area, this fire station will then go and man the downtown fire station.
The facility has a cistern that can hold 52,000 gallons of water, one fire truck with a 750-gallon tank ready to go. 4 firefighters are on duty at any given time, and they're on call around the clock.
We have got a chance to see what our first responders do, and they do it in a way that cause no glory to themselves.
And while the Emile Berry Fire Station is brand new, the firefighters are old hands. So when duty calls around Northside or any other part of the island, Echo Company is ready for action. April Knight for News 2.
The newly named Emile Berry Fire Station is now fully operational and also doubles as a multi-purpose center. Well, this week is Fire Prevention Week, and our local firefighters are drawing attention to the fire prevention theme and also have some fire safety tips.
The theme for this year's fire prevention is preventing kitchen fires. So, you know, I want you guys to be cognizant and not placing anything on the countertop of your kitchen or having your children or child playing in the kitchen with any balls or anything.
Well, October 6th through the 12th marks Emergency Nurses Week, and ER nurses at the Juan Louis Hospital did something a little different to demonstrate their importance. They held a mock Code Blue Monday in the hospital's cafeteria at high noon, complete with ambulance and a full complement of emergency room staff.
We've been working together for many years, doing exactly what you saw us do here today with excellent results.
We wanted to give everybody a chance to see what exactly we do behind closed doors when we do have a trauma or a code situation.
I think that this mock code was excellent, and I think we should do more mock codes because this is the first mock code of many years. We're the only unit who have done something like this, and this is something that should be passed on for many years to come.
Meanwhile, Juan Louis Hospital is not just celebrating ER Nurses Week. They're also celebrating Healthcare Food Service Workers Week. And this year's theme is Where Healthcare Meets Hospitality. Annually, these food and nutrition professionals are honored for the role they play in helping employees and patients remain healthy and well-nourished, like they do at the Tropical Treats Cafe. The physician's assistants were also being recognized at the Juan Louis Hospital. This week is National PA Week, and they take this time to educate the public on the importance of the profession and living a healthy lifestyle. Emergency Medical Services Division of the Department of Health completed training on EMS charts system, an electronic data patient care reporting system. A total of 61 individuals, including staff, emergency medical technicians, paramedics, and administrators, Virgin Islands National Guard, and Port Authority EMTs, along with highway safety administrators, completed the trainings, which were sponsored by Virgin Islands Office of Highway Safety and National Highway Safety Traffic Administration. The VI-EMS division worked side by side with the hospital's rescue, fire, and other first response services to provide the highest quality of emergency care to those in need 24 hours a day, 365 days per year. Charles McSweeney of EMS Charts provided training on St. Croix and St. Thomas for the entire staff. Patient care reports and documentation are now created electronically through a secure World Wide Web host site and stored there electronically. Well, turning our attention stateside, with no deal in sight on the government shutdown, President Obama and Congress are heading toward another deadline, raising the debt limit. The president is sticking to his pledge to not negotiate with either a temporary spending bill or a debt limit. House Republicans say they won't pass bills without negotiations. Danielle Nottingham reports from Capitol Hill.
President Obama and House Republicans are standing firm